open this up. Okay, I'm going to get rid of this. Now, I'm going to go right here on the edge, and what I'm taking out is my sterile drape. Okay, I want to open that up, but I don't want to be touching any surfaces. I'm going to put that right there. Okay. Now, I need to put on my sterile gloves. You can do this two different ways. You can work right here if you feel comfortable putting your sterile gloves on that way, or you could have opened up your sterile tray, set it to the side, not taking the placemat out, put your sterile gloves on there once you had your sterile gloves reached in. There's multiple ways you can do this. Moral of the story is stay sterile. Okay? Now, I can do my gloves right here. I feel okay with that. And if you feel okay with it, again, that's fine. I'm sterile. The stuff in this container is sterile. I'm going to put it over here on my sterile field. Okay, Rebecca, this is where I need you. If you can step right up. I would like for you to pick up that bottle of normal saline. Okay, I would like for you to step right over here. I would like for you to open it up, and I would like for you to pour just a little bit into that bag or the trash can, whichever is close by. Pour it in there. Very good. That is called lipping. Now I want you to come back over here, and I want you to pour some of that solution into my container there. Okay, perfect. Now you can just set that back down right there on the wooden part of the overbed table. Okay, very good. Now, ma'am, are you allergic to iodine? No. Are you allergic to plastic tape? No. Okay, good. Well, what we're going to do is we're going to clean your incision a little bit. So I'm going to take that, I'm going to put it here, wet it with my saline. I can squeeze it out a little bit. I'm going to take my forceps. I like to use the forceps, so I take that. Then I'm going to come to the surgical area. And remember, I told you from dirtiest to cleanest, so I'm going to start in the center. I will do me a circular motion and clean that. This is not a very dirty wound, so I don't need to go back for a second or third time. Now, I will drop those items into my trash bag. Now, I'm going to take another gauze, and I'm going to dry it. And I am going to pat it dry. Real gently. Not taking off any of our new granulated tissue. I'm going to drop that in my trash bag. Now, I'm going to apply a gauze over it. Then I'm going to apply my ABD pad. They use these because they're very absorbent. Okay. At this point, I don't have to be sterile anymore. Okay. So, you can either choose to take these gloves off and put another pair on if you would like, or you can just use these. So, I tear off the amount of tape I think that I need. I want to put enough tape on it that it's secure, but I don't want to put an excessive amount on them, on their skin. Like I would like to put one down here, but I know that's going to be along the lines of her pubic hair, and that can be very uncomfortable, so I'm not going to do that. Now, what I need to do is, if I had a pen, I would take it, a Sharpie, I would write the date, time, and my initial that I did this dressing change. That way, let's say this is a dressing change that needs to be done each shift. If it's the end of my day shift and it's 2:30 before I get to it, And then the 3 to 11 shift comes on, and it's 4 o'clock, and the nurse comes down there. She wants to go ahead and get her dressing done, but she looks at it and she says, oh, it's only been an hour and a half since I changed it. That way she knows, hey, I need to wait till a little later on to do that. So then I asked the patient, how did you tolerate that? Are you doing okay? Good. Is there anything else I can get you right now? No. Okay. Well, I really appreciate it. Thank you. Then I put the bed back down in the lowest position. And then I will clean up all my supplies, go document.